Hello, everyone. Welcome to Bringing Virtual Care Home. My name's Tina Null, and I'm the Chief Clinical Officer at Anelto, and I'll be your host. Today, my guest is John Halsey, the Chief Growth Officer at Recuro Health. And today we're going to be talking about scaling digital health, and John's a pioneer in that area. So welcome, John. Thank you for agreeing to be my guest.
Hi, Tina. Thank you for having me.
Let's get started today by having you tell the audience a little bit about your background.
Sure thing. So I'm the Chief Growth Officer and one of the co-founders of Recuro. My other co-founder is Michael Gorton, founder and CEO of Teladoc. And where I am today with Recuro goes back to the very early days of Teladoc. So I actually led the A round of institutional money into Teladoc, which was, a really cool idea, really kind of scaling convenience care. The interesting aspect, though, is really oriented around the direct to the consumer. And so I love the model, but I hated the execution. And so at the time, we were not getting, consumers really weren't getting at scale their health benefits. That really goes through payers, through employers or insurance companies. And so my material contribution at Teladoc back in the day was to help orient the model to go after payers, employers. We really focused on mid-market employers and the success, in partnering with some of the aggregators like brokers and TPAs and, taking that upstream to large group employers and then ultimately to carriers. So I did that. Michael and I both stuck around through the D round of funding. Michael had amassed a great collection of talented operators, and I was fortunate to be a part of that. And then, Teladoc has continued to succeed and, really exciting to watch them continue to grow. I then moved on. I sat out for a little bit and then got involved at MD Live, another telehealth company. And it functioned in a similar role, leading the growth and sales side of the shop. Stayed there for a few years and then moved into other population health mechanisms around chronic care, advanced illness. So some really cool things, but really all about scale and using data to identify gaps in care and where there's a gap, there's going to be an exacerbation. And with scale, we can intervene efficiently. And that's taken me to Recuro. And so Michael, who somebody I've been fortunate to collaborate with over the years, reached out to me a few years ago, and he was approached to look at telehealth again. We really didn't want to do Teladoc 2.0. I mean, again, great company, but the goal, I think, for us was to do something more holistic, more impactful, preventative, leveraging data, not being quite so reactive. The Teladoc model, or the first iteration of telehealth, was really about low acuity, non-emergent care. Which was really great, but now convenience care it's not so much just a modality, a communication modality, but it's really about an engagement strategy that can drive a better outcome. And so that led us to Recuro, a digital health or telehealth company, but to execute on it, we did something different. We began acquiring different tools and companies and resources that would sophisticate the model to make it stickier, to support a broader, preemptive, proactive engagement model. So that's where we are now. And again, we've acquired 6 companies, have just a tremendous collection of operators and entrepreneurs, spanning multiple verticals, and it's really an exciting time for us all.
So when you're successful marketing your solution to a payer, then how does the payer execute that and make it turn into a patient experience?
Sure, that's a great question. I think fundamentally you have to look at the current paradigm, again, predicated on telehealth of 20 years ago, right? And where telehealth was kind of carved in, it was embedded as a convenience care modality with very low utilization. Today, and really with the experience of COVID, right, COVID has helped to rationalize digital health in general or telehealth in general. We see a utilization up almost 40% higher than pre-pandemic levels. So inherent in that, and inherent for us as operators, is to do something that's not just about engagement, and a term I've used, but to do something that focuses on the outcome. And so to do that, telehealth and other modalities of engagement can't live on an island, right? They have to interact and interoperate, share data, and so the way that we work with a payer, whether it's a large employer or a health plan, is we integrate into their existing ecosystem, either leveraging our own ecosystem of solutions or the existing payer's ecosystem of solutions, and pass information, pass patient information and patient experience in a seamless manner. And that's a fundamental change from where care was, digital care or telehealth was 20 years ago. And it's really exciting to do that. It enables us to be oriented not so much around engagement, which I would argue is the front end of the funnel to an outcome. So if you look at engagement to get an activated patient to get us behavioral change can drive the outcome. And so we want to work with a payer and integrate with what they're doing so we can get that outcome.
So what is the carrot for the patient? Like the payer offers the patient a program based on your solution. What is that carrot for the patient to be involved or engaged? I guess I'll use your word.
I'm going to take a step back and say the carrot is really different for the plan sponsor depending upon where they are, and then I'll come back to the patient. So when we work with payers, it could be a commercial payer, it could be a Medicare payer, both a Medicare Advantage or an ACO or some other entity, or it could be looking at Medicaid populations. The carrot is really the problem that we're solving for. So one size does not fit all. Telehealth of old, one size, here it is, you call it sinusitis, bronchitis, whatever. But today it can do much more. For the commercial population, likely part of the problem is, so it's access to care, but it's also this inundation of multiple point solutions. For the plan sponsor, it's vendor fatigue. That kind of turns for the member, that's engagement, the front end of the funnel. It's like, gosh, which of the many things do I go to? And if I don't know about it, and it's a poor user experience, it doesn't get engaged and you can't achieve the outcome. So the goal for the commercial member is real, or the commercial plan sponsor is really, or one of the points is about vendor fatigue and kind of creating a more connected, cogent user experience for the plan sponsor that will get that outcome. If you think about Medicare, right, these are multi-morbid, more chronic, right? And so having the right data, contextually relevant information to the provider and the patient in real time becomes really relevant. So we're talking about, device data, remote patient monitoring, other care models that use the right information at the right time, the right setting, the right modality to get that outcome. So there's a premium for handling that data and the efficiency associated with that. That's the pain point. If you think about Medicaid or managed Medicaid, right, all those same things apply, but if you're not also addressing some of the challenges around social determinants, you fail to engage, right? And so using whatever solution, for us, it's digital health and some of the supporting constructs in concert with one another to solve the problem for each vertical. Commercial, Medicare, Medicaid becomes the game changer, which drives, the carrot for us is appropriate engagement of the member, which drives the plan sponsor's outcome. So engagement for commercial is different than engagement for Medicare versus engagement in Medicaid. Well, a lot of words.
Yeah. Yeah, and so when I hear you describe that, anytime I'm hearing that ultimately you're trying to get to an outcome, I'm thinking value-based care. You are very much looking at how you keep that patient as well as possible to improve their quality of life and to decrease overall cost of care. Would you say that's accurate?
Yeah, 100%. So I think the old adage of following the money, value based care has shifted it's the whole delivery model from that of a financial mechanism, from fee for service to some other back end mechanism, to really orienting around the outcome. Right. And so we at Recuro, we think of we're truly trying to take a population health approach, which is very much aligned with tenets of value-based care. Again, pulling the right information, the right time, the right setting to drive the appropriate outcome. I think that's the challenge, the mandate that we all have right now, now more than ever.
So what do you see as the barriers that are still in existence to digital health?
Yeah. So a lot of them. So COVID helped to rationalize, the broad use of digital health. Although from probably the biggest one is from a regulatory standpoint. During the pandemic, we saw temporary, cessation or kind of a relaxation of some of the regulatory concerns. And now post COVID, we're trying to return to old. I think the genie's out of the bottle. I think clinicians are and health systems and health plans, and we're slow to really embrace, but I think it's inevitable. The genie's out of the bottle. I think that we can look at the ability to leverage more frequent touches to drive better outcomes. That becomes paramount when we think of the number of aging baby boomers, the seismic shift that we see in Medicare spend moving from an acute setting into the home. That's not going to unwind. So I think regulators are beginning to adjust to the new norm. They want to make sure that appropriate safeguards are in place. But part of that is also clinicians becoming comfortable with seeing the better outcomes delivered by touching and interacting in a traditional setting, but also scaling by using care teams and virtual modalities, device data and video. You just if you can touch a patient and you can impact and interact with a patient 4 or 5 times, 6 times in a year, you're going to do much better than an annual time. And then if you apply that same model to chronic populations, more frequent touches are going to drive better outcomes. We have 135 million ish individuals with one or more chronic condition. So we've got to find something that scales. I think it's going to happen. I don't know if I answered the question. Going back to your question, I think regulators are going to be understanding and becoming more comfortable with this as a modality. Patients and providers really embracing this as the new norm. Those are the barriers, and we're seeing those come down daily now, and it's exciting.
Yeah, it absolutely is. I mean, I think it's a foregone conclusion that patients are most comfortable in their own homes. So if we can get care into their own homes, then they're in a natural environment where their ability to be successful in achieving their highest level of health is also, again, a foregone conclusion. So what's next for Recuro Health that excites you the most?
So I touched on it just barely at the beginning, but so Recuro was born out of kind of aggregating a number of different companies or entities. We've acquired 6 companies to date. There's no endpoint to that. So we've acquired informatics companies, technology companies, home lab, genomics. Um, I think for me, the part of the excitement is that what the next acquisition or enhancement, it just helps to sophisticate our model, that helps us scale, that helps us solve more problems, to expand the breadth and depth of our ability to drive an outcome. That's what's so exciting for all of us right now. Whatever we can do to scale, to impact more patients, to support more caregivers, to deliver on more personalized engagement models. That's the task at hand for all of us. That's what we're actively doing. We're looking at the next potential additions to our company through acquisition or through partnerships that expand our ability to solve big problems, and it's exciting.
So, your platform that is available to providers, clinicians, payers to interpret data, would you say that's more clinically based or more on the business side from an analytics standpoint?
Yes. Right. So, we, depending upon who we're talking to, when we partner with pay. So first of all, if you understand kind of value-based care, and we think about vertical integration, we have these new terms, payvider. You have providers that are taking risk. You have payers that are delivering care. You've got retail providers that are now getting into care delivery. So when we talk to somebody who's involved in delivering care, partnering with a provider organization that probably is taking risk in some form or fashion, whether it's in a retail clinic or it's a health system, it's about leveraging contextually relevant data in real time, integrating those disparate data streams, and facilitating broader engagements and broader handoffs to other care providers. Right. And in a care model, in our model, we integrate behavioral health, but we also have workflows that support referrals to specialty care providers. And that becomes really kind of cool and fascinating. But I tend to think, from a payer lens a lot of times. And again, that goes back to some of those multiple point solutions and having them talk to one another. So at a macro level, getting the right solutions aligned and communicating with one another so that the provider and the patient can have that meaningful interaction at the same time. So again, the answer is yes. Clinical and business, integration becomes paramount.
Yeah, so it sounds like your solution is almost more of a network where it connects everyone that is involved in that care episode up to the payer. Is that accurate?
It can be. So, so each use case is unique and different. So, in many cases, it doesn't require all of that, or require all of that. But when you're supporting a broad health system with multiple sites of care and multiple providers, that becomes almost a table stake to be able to execute at that level. But if you don't need it, if it's not required, when we're partnering with a plan sponsor or an employer or a specialty insurance provider, that becomes unnecessary, and we can turn on or turn off certain connectivity points in our platform, our solution. We have our own network of providers. Primary care providers, behavioral health providers, we can turn those on or off if we're deploying our platform, our technology around an existing provider panel. They don't need that, and so we won't provide that. We become the scalable technology, that enabling technology. But where there's limited access to providers, this becomes a particularly enabling, impactful care gap filler for.
Great. So who is your biggest customer today?
So there, I mean, would be large insurance companies right now. So we serve a couple of very large managed care or MCO entities, jumbo employers, not dissimilar to what we did at Teladoc, right? We started off 2 years ago working with mid-market employers, leveraging that upstream to larger employers, and ultimately now to the health plans. The health plans, I think, to me, really are more impactful because we can impact, and reach more thousands, hundreds of thousands of lives at a time, and that, digital health scales, right? And so that's the opportunity for us, and the mandate and the need for us now.
Yeah, and the win-win is thousands of more patients are healthier and overall cost of care is coming down
Yeah,
when
it's
you
really
do that.
exciting.
Yeah,
Yeah, it's
yeah.
all about
Well,
the
great.
quality.
So, do you have any parting words or want to tell our audience how they would most easily contact you, or if they have interest, where to learn more about you?
We have an active website, and we're constantly pushing out blogs. Kind of the world from our perspective. So visit our website, recurohealth.com. But in general, we'll have our own perspective that we'll push out there, but we'll also aggregate other content. So it's not just about our perspective. We love to learn from others' perspective. Reach out to us. We reach out to us through the web, or read some of our content, sign up for our newsletters, and then connect back to us. We'd love everybody's opinion and perspective. Again, I appreciate the opportunity just to chat. This is I get really kind of preachy, but it's such an exciting time to be in this space where we can leverage data and provider networks and various technology modalities, and have them all connect to deliver care, to work to an outcome. If you want to talk about that or learn more about that, reach out to us.
Yeah, it sounds like you have somebody looks at your website, they can contact you and say, "Here's the problem we're trying to solve," and you most likely will have
Exactly.
something to offer to bring value to that particular potential customer.
Yeah, absolutely. So I probably didn't say that as eloquently as you did, but yes. But it actually, you said the magic phrase. It's really about the problem we're trying to solve. So that, one size does not fit all. What's unique to you, or to a plan or a provider or an employer. Everybody, based on their geography and their population and their employees, right? They're all looking. They had unique issues and challenges, and it's exciting to be one of the solutions that can help address that. We're excited about that.
Well, I want to thank you again for being willing to be my guest today and tell us about Recuro Health. And for all of you out there, I hope you'll join us soon for another session of Bringing Virtual Care Home, and you have a great day.
Thank you.